Medical bills or your mortgage. Now at 5:30, a Charlotte family being forced to make that difficult choice. Good evening, everyone. Thanks for joining us here at 5:30. I'm Bobby Sisk.
And I'm Jennifer Copeland. It is a tough decision no parent ever wants to make. Pay for health insurance or pay the mortgage. But that's exactly what it's come down to for one Charlotte family, and it is not easy, especially with a sick child. She was born 12 weeks early.
She's been through the ringer, I'll tell you that.
A 1-pound baby doctors said wouldn't survive.
She was one of the smallest babies to ever go under heart surgery, open heart surgery.
But Kaylee Ann Freeman is still fighting for her place in this world. 8 months old, the size she should have been at birth. She's a mere 7 pounds.
In the last week, she grew 200 grams. And now know that she was only 470 grams.
She's never seen beyond the walls of the pediatric intensive care unit at Living Children's Hospital.
We just started holding her again. It had been 2 months since we had held her.
And she may never see the room her parents prepared for her.
Our foreclosure date is set for March 30th. We don't see how we're going to get out of that, get around it.
By the time Kaylee goes home, the Freemans will have had to move. Both successful real estate agents before home sales began to dry up. They have to pay their own health insurance, $1,000 a month. And it's either pay the insurance or pay the mortgage.
We don't want to have to worry about if a doctor will see her, they'll do a surgery, or every time they come in to do an x-ray or put on a diaper, how much is that going to cost us?
With the medical bills, the stress at the hospital, and foreclosure coming, it's overwhelming.
We don't really know in 30 days where we are going to go or how we're going to pay for it.
But they're trying to stay grounded, remembering what is truly important.
Even though we are going through such a tough financial situation, I mean, we're losing the house, we barely can pay insurance, we've lost one car already. That's not the point. The point is we were given something that we can show that we can handle. I mean, God doesn't give you anything that you can't handle.
Now, the Freemans say Kaylee could go home in a month if she continues to improve, but it's going to be a long road. She will need a nurse at home for at least a year, maybe 2.